Again, so she's being interviewed here by Dr. William Powderly, who's also a physician. And so here's the introduction. I'm just going to play just very briefly here. So here's Dr. Rochelle Walensky. This is part of the Washington University in St. Louis. I want you to pay attention to what happens right here. So watch this.
It's so amazing to have everybody be super quiet all of a sudden. I think it's because the dean's here. Or maybe the head of the CDC. I'm not sure who's more powerful at this moment.
So as you can see here, this is the classic thing that we've seen on television over the past 24 months. Fully vaccinated and presumably fully boosted people wearing a facial covering, but when they approach the podium, it's now suddenly safe to take off the facial covering. Now, you might say, well, of course you want to take off the facial covering so that people can hear you. Oh, really? So now there are side effects associated with wearing a mask. Well, why haven't we given children the opportunity to hear what their teachers are saying, to be able to read and intelligize the nonverbal cues that are so important for understanding language and communication and interpersonal relationships? Well, it seems to be only important when you are in the position of power. Your children, future doctors, by the way, there are future doctors that are in school right now that are masked. Now, if you look here throughout the room, all these people are wearing masks. Here's why I point this out, my friends, because I went to the CDC's own updated website, cdc.gov. Right on the front here, you can put in your county. And in that county, through their new metrics that they just sort of rolled out last Friday, it was about a week ago, right? There's things I want to say about that, but I'm just going to pause here. All right, I'll try and keep a straight face, okay? Now, if you look here at St. Louis County, which is where this meeting is, presumably, unless there's some other branch of Washington University that's outside of St. Louis that I don't know about, but very sure here that 99.9% sure this occurred in St. Louis County. According to the CDC's own website, masks right now, because the transmission is moderate, are not recommended unless you are immunocompromised or very high risk. So as you will see here, all these individuals are masked, including the director for the CDC. So here we go. Here's Dr. Rochelle Walensky. As you can see, look at the lower right. Okay. This is the spouse of the former doctor who was a leader in infectious disease research, and they're creating this grand rounds that's named after him, Gerald. I can't remember his last name, but I'll put it there. So there's Dr. Walensky. Okay, remember, when she goes on stage, she takes the mask off, but when she's sitting right there, she's wearing the mask. I mean, honestly, you know she's fully vaccinated and boosted. So why is she wearing the mask when her own organization revamped and rejigged their numbers and their guidance to suggest that based upon the community level of transmission, and then there's some sort of aggregate that also accounts for levels of hospitalization and hospital capacity. So she's in St. Louis. Why does she need to wear the mask? But then when she goes on stage, she takes the mask off. And you might be saying, well, of course she does. She wants people to hear her. Oh, so hearing the person talking matters? Oh, it does. What about all the kids where their teachers are masked and all of their fellow students are masked? We might say, well, the kids are resilient. Oh, really? Are they? Haven't we learned now that there's developmental delay, there's changes in speech, there's reduction in the number of words that kids know at certain ages, and they're not hitting previously benchmarks that were normally sort of surpassed at certain ages. We're having to sort of roll those back a little bit. So all of a sudden now, it's okay for older people around other older people to remove their mask, but it's not okay for you or your kid to wear a mask. That's just hypocrisy number one. Okay, now we're going to talk a little bit about what she says, that science has nuance and context or areas of gray that should be appreciated. Now, I want to really focus in on this because, again, this is a message we talk about all the time, whether we're talking about fasting or weight loss or nutrition or sleep or masking, right? I've gotten in a lot of trouble for saying, do you really think, and questioning people, do you really think those homemade facial coverings are doing much of anything? And I've been called every name in the book and all this sort of stuff, and I want my grandma to die, and I'm promoting genocide. I mean, the comments have just been totally egregious, which is not what I'm about anyway, as many of you know. However, it's interesting to hear the director for the Center of Disease Control actually say that, you know what, we try to follow the science, but as you know, the science is changing and there's gray area.